Ammara Rafique. I'm a PhD research scholar at Department of Biochemistry, University of Karachi, and I'm also a teaching assistant in the same department. And my research interest is on neurosciences, and I have worked for almost 7 years on cerebral palsy topic. And my work is on interventions basically, but I have also worked on the morbidity frequency and risk factors for cerebral palsy patients. I'll discuss everything in briefly in my presentation. So, shall I start with the topic?
Yes, yes, Ms. Mara,
Okay.
definitely.
Okay. So the topic for my presentation is comparative study of anxiety and depression among the caregivers of male and female cerebral palsy children. So, this work is under consideration by Pakistan Journal of Public Health, and Dr. Zara is my co-author in this paper. So, Dr. Dahel has already discussed the term cerebral palsy, but I will brief it uh, for people who have joined us later. That cerebral palsy is a neurological disorder which is caused due to formation of lesions in the brain before birth, during birth, or shortly after birth. And the CP inflicted children are dependent on their caregivers for activities of daily life. Okay, the signs and symptoms of CP children may vary from case to case depending on the extent of brain injury. CP primarily affects the motor movement, posture, balance, but it can also affect the feeding, cognition, communication, and behaviors. So, the epidemiology of CP is that I cannot remove the first line. Um, Okay. Epidemiology of cerebral palsy. Worldwide, it affects 1.5 to 3 per thousand live births, but unfortunately, in Pakistan, we have no such data. So, back in 2017, I intended to collect data from whole Pakistan. I contacted several health organizations to collect data, but there was lack of data and diminished response and high-handed restrictions and unjustified denials. So I had to condense my study to Karachi city only. In Karachi, there is a population of almost 2 million people. So I visited almost 70 health organizations, and there was only 20% response because none of them had data on cerebral palsy. Only 14 health organizations provided us the data, which was of almost 658 CP cases, and we observed that there was 1.4 is to 1 male to female ratio of cerebral palsy in Karachi, Pakistan. I have also written and mentioned that issue in an article in an international journal, which is Kokorova Medical Journal. I have written it like there is a higher burden of cerebral palsy in Pakistan, but there is no data. So I have identified, I have mentioned the obstacles that I encountered while collecting the data, and I have also given them suggestion and I have also requested the government that they shall establish an integrated electronic or manual database for cerebral palsy patients. Moving to the next slide. So there are several risk factors that have been reported yet, and it includes head injuries due to sudden fall, car accidents, or child abuse. There may be twin or multiple babies, brain infections, low birth weight, genetic predispositions, and lower gestational age, or intracranial hemorrhage or bleeding into the brain, and maternal factors likely gestational diabetes, hypertension, or even malnutrition. So there can be a severe jaundice in the children, and these all risk factors may occur before birth, during delivery, or shortly after birth. And CP is classified based on the limb that is affected, which is topographical distribution on the basis of muscle tone and severity, and gross motor function classification system, which classifies according to the range of limitation in the facultative limb, and which classifies from level 1 to level 5. So again, there was a paucity of data on the risk factors of cerebral palsy. I collected data from the biggest rehabilitation center that is solely catering to cerebral palsy patients in Pakistan. I collected data from 1997 to 1995 to 2017, and there were altogether 120 cases. And in those cases, I collected the complete medical details, and I predicted the probable causes of cerebral palsy based on their medical condition. And there were prenatal causes in almost 75.8% of cases. So I have submitted that paper to Rockland Medical Journal, and during that data collection, I also observed that most of the parents, almost 60% of parents were of CP children were cousins. So I again decided to conduct a survey and to observe if to identify if there is a connection of consanguinity with abnormalities in the descendants. I will discuss it in later conferences if I can get a chance. And I have also written an article with the title "An Insight into the Risk Factors for Cerebral Palsy in Pakistan." In this article, I have also mentioned that there is a necessity to establish data on the prevalent risk factors of cerebral palsy in the region, because they might differ from the prevalent risk factors in Pakistan from America or Africa or any other region. So there might be some other dominant prevalent factor in Pakistan. And now the treatment. A treatment is usually there is a multidisciplinary plan for cerebral palsy patients, and which includes medications, equipments, therapies, even surgeries in extreme cases. So I have also worked on interventions. I have introduced basically two novel auditory and sensory interventions for cerebral palsy patients, and these research work are under consideration by several journals, and I have presented that work in international conferences as well. I will discuss that there were significant beneficial effects on the blood parameters, cognitive functions, and physical and behavioral outcomes. So I will discuss those interventions in later conferences if I get a chance, inshallah. Now, I also identified that there was a huge research gap when it comes to use of acupuncture-based rehabilitation for cerebral palsy patients in Pakistan, and I identified that there was a paucity of skilled and licensed acupuncturist in Pakistan. So that is the area which has to be have a new research in that area. So now the oral health of cerebral palsy patients is also a neglected domain. The cerebral palsy patients have drooling problems. They have dysphagia, swelling difficulties. They consume carbohydrates more in their diet, so they are likely to get tooth decay. Dr. Zara also co-authored this paper. We conducted a research on that topic as well. Now, the main topic that I'm going to discuss here is the anxiety and depression in the caregivers. The dependency of CP inflicted patient has a direct influence on economic, emotional, physical, social, and marital status of caregivers. So it sometimes become a full-time occupation for the caregivers, and thereby, the research has also indicated that the caregivers, especially mothers, have higher level of anxiety and depression. So we need to have research on this particular context in Pakistan. So in the current study, I compared the levels of anxiety and depression among the caregivers of male and female CP inflicted children in Karachi, Pakistan. The inclusion and exclusion criteria were that primary caregivers who were living with the CP child and they don't have any psychiatric disorder were the exclusion criteria, and exclusion criteria were the presence of any other disabled child or dealing with an obstacle that is affecting their quality of life. And the participants that the institute didn't permit were also excluded. For the current study, we took approval from the institutional board of University of Karachi, and we also took permission from AURA, Alumni Rehabilitation Association, where the study was conducted. It is one of the biggest rehabilitation center in Pakistan, which is solely catering to cerebral palsy. So I conducted study there after taking their permission, and I approached 46 caregivers, but only 30 of them were available for the study. So we gathered the comprehensive data of CP children from the admission files of ORA, and then we divided those uh, caregivers into two groups, group one and group two. Group one had caregivers of male CP inflicted children that were 13, 19, and in the group two, we grouped caregivers of female CP children that were 11. So face-to-face interviews were conducted with them to collect data of sociodemographics, and they were asked to fill out the hospital anxiety and depression scale. So the instruments employed were that we collected data of characteristics data of CP children, which encompassed age, gender, gross motor function classification system, mobility, muscle tone, severity, topographical distribution, and presence of any secondary problems. And in the socio-demographic questionnaire for primary givers, there was a 14-item questionnaire that was self-designed, which encompassed age, absence from work or commitments, blaming by people for disabled child, district of residence in Karachi, and education level, gender, income level, marital status, occupation, relationship with the child, religion, social support, and a total number of normal and disabled child. So the hospital anxiety and depression scale for primary caregivers is already established scale by two scientists, Knight and Zygmunt, and it has a higher validity and reliability, and it has also 14 items in the scale, and it can assess the anxiety and depression. So for the statistical analysis, descriptive statistics were calculated and an independent t-test was employed to compare between group differences for the primary caregivers of male and female CP children. So now the results. We identified that we observed that there were no significant association between the characteristics of CP with the gender of CP inflicted children. And there were more serious cases of CP in group 1, that is of male CP patients, as compared to group 2 with female CP children. And the dominant uh, characteristics in group 1 were that most of them were aged within the age bracket of 10 to 19 years of age, with the gross motor classification system level 14, level 4, and spastic muscle tone, wheelchair dependency, moderate severity, diplegic presentation, and poor attention span. But in both groups, the additional impairments were comparable. For the socio-demographic data, again, there was no significant association between the socio-demographic profile of the caregivers with the gender of CP-inflicted children. And most of the caregivers were within age bracket of 30 to 49 years of age. They were married. Most of them were mothers. They belonged to religion Islam. They had a secondary level of education. They were residing in central district of Karachi, Pakistan, and they were housekeepers who belonged to a middle income level, and they had presence of other child children, normal children, and they were having social support from their immediate family, and they also reported no absence from work or commitments due to caregiving, and they also reported that they were not blamed for any disability in the child. Now the main focus that comparison of anxiety, depression, and total head scare for the caregivers of male and female CP children. We observed that the anxiety, depression, and total head score in the caregivers of male CP children was significantly higher than the caregivers of female CP children. You can see in the graph here uh, all the readings. Now the discussion. To the best of our knowledge, it is for the first study in the literature that has compared the level of anxiety and depression among the caregivers of male and female CP children in Karachi, Pakistan. And our findings demonstrated that in caregivers of male CP inflicted children had significantly higher anxiety, depression, and total head score as compared to the caregivers of female CP inflicted children. It's obvious because there were more serious cases of CP in group 1, as I discussed in the results. So obviously, this might be reason of higher anxiety and depression reported by the caregivers. If a case is more serious, of course, it needs more attention of the caregivers. Another author has also reported that male CP-inflicted children lower functional capacity and lower socioeconomic level may increase the burden on the caregiver. And in our study, the children in group 1 had almost 79% of additional impairments. And these impairments can be present in almost 25 to 80% of cases, as reported by other authors. And the additional impairments can make them even more dependent on the caregivers. So this might be the reason for high reporting of anxiety and depression. And in the present study, the mean age of primary caregiver was comparable, but most of them, the caregivers were mothers. So another author has also reported that mothers of CP-inflicted children have higher anxiety and depression level, similar that which is concordant to our study. Now, the study have revealed that there are several reasons associated with high level of anxiety and depression, including lack of social support, low income status, gender of primary caregiver, and the child's intellectual disability. So now, coming to the next point, many of you might not agree to me, but that's purely my perception that in Pakistan or other regions, usually a male child is given more preference than a female child. So as males are the breadwinners, inheritor of assets, carry the family name, and are a source of protection and support for parents in their old age. So caregivers are usually more concerned for their male child, so they actively take them for rehabilitation and they are more concerned for them. So obviously that care and that anxiety makes them more prone to get anxiety and depression problems. So, the caregivers, especially mothers of CP children, must be provided adequate psychological, moral, and social support. And to ensure the efficacy of the intervention that we are providing to CP children, we must also consider providing interventions to the caregivers so that because it is correlated to each other. So, the interventions likely cognitive, behavioral, and psychoeducation has been reported to be effective in improving the mental health of caregivers of disabled children. Limitations of the current study was a very small sample size because very few of them gave us consent for inclusion in the study. And another limitation of the study was that we only conducted uh, those interviews in a single rehabilitation center because it's the biggest institute, and in other rehabilitation center there are disabled children, several disabled children. So not only cerebral palsy patients. So we only conducted study in that particular rehabilitation center, and more research with sufficient samples from multi-centers can be conducted in future to further validate our reported findings. Moreover, we did not assess the quality of life because, but this caregiving has a significant impact on the quality of life of the mothers. So, concluding the study, the present study indicated that the caregivers of male CP children had higher anxiety, depression, and total health score, but we recommend further study with larger sample size. Um, Future prospect is that research is necessary for in this context for better understanding of the factors that affect the anxiety and depression, to plan adequate health policies on mass scale in Pakistan. And it is essential to diagnose and develop adequate intervention as a foremost objective for minimizing the anxiety and depression problems of caregiving in Pakistan. Now, I would like to acknowledge the Alumni Rehabilitation Association, where I I conducted those interviews, and they also provided us data for the current study. And I also conducted the intervention study, the comprehensive work there for my PhD. And I am also grateful to the team of OLCIAS conference, especially Ms. Ghazal for providing me this opportunity to come present my work here. And for future, if you are interested in knowing the interventions or other work, you can always visit these links. And I'm also looking forward for collaborations and postdoctoral positions anywhere abroad. So if anybody has any good project or any good collaboration research work, you are more than welcome, and I would love to connect with you. And if you have any questions regarding this presentation, you can ask me.